All these guys have a lot to say, and they've all done a great job presenting their remarks. And another round of applause for Mike, Dan, and Dave. At this time, we're going to take your questions. So if you have those cards, those 3x5, 5x7, or 4x6 cards, and if my team can get up and gather those cards, I'd appreciate it. Just scratch that out on the card, pass it to the end of the aisle, and we're going to ask your questions of this panel. But before we do that, I want to let you know a couple things that are going to happen. We're going to do this for about 20 minutes. And then we have 4 wonderful breakout sessions that I'm going to guide you towards. One on estate planning with David Gianelli and Associates. One on real estate with Paul Harmon at PMZ. He's going to look at real estate at the street level and really communicate to you what's going on right here in Stanislaus County. That's going to be right here on the first floor lobby as you walk out the door. Third up is investments with Jeff Burrow. You'll stay in the theater for that. And fourth up, we're going to have identity theft and economic crime prevention and protection tips with Sergeant Craig Plant from MPD on the first floor lobby. So we got the questions coming. I have a couple that I'd like to ask. Number one, Dan, you mentioned that you would start a business today in this economy. Would it be a manufacturing business, a service business? Do you have any recommendations of businesses that you could see with low startup but has great potential to be successful? Is there a business out there that you would say most people could run this business and be successful? What would it be?
If I did, I wouldn't tell you.
Okay. Because I would tell you and he would be mad at me.
That'd be my next big idea. No,
this is a little idea.
I just think that business it's everywhere, and I think that that question is a little bit similar to what Mike was talking about. There's an individual inside all of us. You know, we all own stock. The stock is ourselves. You know, before I owned a business, I was the CEO and major shareholder, the only shareholder of the Dan Costa Company. And it was me. It was inside me. And what could I do? What was I good at? What could I tolerate? You know, what was my abilities? And I think each person needs to kind of get inside themselves. But then, you know, at the end of the day, just do something. Just do it. It's okay. It's good if you create a business and it's successful. It's okay if you create a business and it's not. You'll learn something by doing it. And I think today that a lot of young people they think that way about work. They're not going to work because they don't have the perfect position. They didn't find the perfect job. I spoke to a young man the other day who's 27 years old. He wasn't working. He says, I just don't know what to do. I said, you ever try sweeping? He said, well, you know, there was some guys that were, you know, friends of mine, and I was working with them. What do they do? Well, they're bankers, and I'm like, so with your education, you think you're just going to, like, go into the banking business? I mean, why are you wasting time on that? You know, but it sounded cool. It's like, well, maybe being a barista at Starbucks is better. Maybe you can meet somebody and just at least you should have 2 jobs right now. So my advice to this young man was go get 2 8-hour-a-day jobs and sleep 8 hours. Do those 7 days a week and something's going to happen. But don't just sit at home looking for the perfect job. So I think it's a little bit, you know, of what Mike said. You got to look inside yourself and know what do you like, what can you do. But whatever it is, just do it.
Okay, quick question for you, follow-up to that. It says Dan, and by the way, we have some of these items that we're going to use as a drawing. So you fill out that blue evaluation form at the end of the evening. You can win one of 5 of these. This person wants to know how the new 511 flashlight is doing.
Excellent.
I wouldn't doubt it.
It's an amazing, you know, flashlight that We're going to give away some here tonight. It doesn't use batteries. It uses ultracapacitors. It lasts for 150 years. No parts. You charge it every day for 150 years. Lasts for 2 hours, and it charges in 90 seconds. And that product was brought to us by a group of people from the University of Idaho who created the concept. But quickly when we saw the concept, we said, yes, we want to make the flashlight, but we want the exclusive for the concept worldwide for all consumers, not just public safety, but all consumers. The consumer model of that flashlight will launch this fall, and it'll be a great holiday gift for somebody to give to someone that's a flashlight that lasts forever. So that business
win
is
one
just
tonight.
starting. They can win one right here.
They can win one tonight by filling out your evaluation form. All right, healthcare, Dave Bin. This is like opening a can of worms, okay? We need your best answer in 1 minute. If you had control over Medicare for a day, how would you get it solvent?
You're not going to like the answer.
Dynamite?
It's you know, it's politically untenable, but some very serious changes need to happen. We've got to change the benefit structure. Either Medicare needs to kick in at a later age than 65, or there's got to be some means testing. People that have wealth may not be able to have full coverage or any coverage at all. You know, unfortunately, when you're talking $38 trillion, it's going to be very profoundly different to fix it. And that's why no one wants to talk about it, because they won't get elected again in another 2 years if they talk about it. And it's really unfortunate because it's going to hit the wall at some point in time. And with the change in terms of the baby boomers aging, the age wave moving into the 65 plus age frame in the next 8 to 15 years, it's just completely untenable. So it sounds very draconian, but some things like that are going to happen. You're going to have to change the benefits for the people that are of my age or younger. I don't think any politician is going to want to change the benefits for current beneficiaries. I just don't
Here's
think
a
that will
follow-up to that. What happens to the cost per month for people who are currently paying insurance individually?
I'm sorry, what
so
happens?
this person wants to know, I think we all agree that the answer is you're going to pay a heck of a lot more for private insurance as time marches on, because we're going to all have to share in the burden of the insurance costs that you so well pointed out today, that the hospital has to make money on somebody. It may as well be the guy with insurance.
Well, we've been kind of forced into that situation. I mean, we'd prefer if everybody paid us the same amount, and even though I'm a president of a region of Sutter Health and we're a not-for-profit organization, if we don't make a profit, we can't sustain our buildings and replace CT scanners when they are 7 to 10 years in age and need to be replaced. So we would prefer it if we got paid the same amount. I'm not sure that that's tenable to get to that position either, but my personal position is I think in the short term, insurance rates are going to go up, because if I was an insurance company, I'd want to protect my risk of someone asking to be covered after they got healthy. The quick analogy is, and this is ludicrous, but it'd be like somebody on a cell phone after waking up dazed after the airbag is deployed and calling AAA and asking for car insurance to fix the car. That's what pre-existing conditions is all about. You have to rate the risk to the insurance company. So I think to cover that, they're probably going to have to cover that by increasing rates to everybody.